So, just back from lunch. Hope you had a good break. Um, I'm Pascal Bijleveld. You nearly got it right. Nearly. And for those who don't know me, I head up ATscale, the global partnership for assistive technology. ATscale is a relatively new initiative. We're based in Geneva, hosted by the UN. And together with all the partners of ATscale, which includes, of course, GDI Hub and many others in this room, we have a very ambitious agenda, which is to try to reach 500 million more people with assistive technology by 2030. And we're going to try to do that in, different ways. Today, I'll focus particularly on our country approach, which is one of the ways that we aim to reach more people. Of course, that's where they are. Our focus is, by the way, on low and middle income countries. And so we partner with governments in low and middle income countries to try to strengthen the whole ecosystem around assistive technology. We're also doing work at the global level, trying to fill gaps in global public goods and trying to influence the market to make products more accessible, affordable, etc. But let's look at countries today. And since we really began our operations nearly 2 years ago, we've now engaged with about 20 different countries. Majority of them in Africa, but some in South Asia, in Southeast Asia, and more recently in Latin America. So I thought I'd share a couple of early learnings from our experience and what we're seeing. The first, and I was struck this morning by, I just came when Vicky, you were talking about joy. And the first thing I guess I want to say is when we go to countries and we start engaging with governments and with stakeholders and so forth, joy comes to mind, and hope, and a sense that, okay, somebody's paying attention to this issue that nobody has been, and it has been neglected, especially when we're looking at it from a sort of a global development perspective, right? This is not top of the list in terms of what most people think about. Now, obviously, we have to temper that because it's a long journey, right? To get to sustainable systems in especially lower income countries for accessing AT, it is a long journey. And I'm not going to talk here about all the challenges on human resources and infrastructure and policies and all of that. I actually want to take a step back, and because there are some even more basic things that need to be addressed before, and that we're seeing when we engage with countries. And those, I'll focus on three. One is awareness, which we've already talked about a little bit this morning in other contexts. Second is fragmentation. And the third is expertise. Now on awareness, and I'm actually the first culprit here. I may have gray hair and I may have been working for 30 plus years all over the world, but actually in this space in particular, I'm still a baby. I've only been involved in this area for the past 2 or 3 years. And until then, even though I, have been thinking a lot about how do we reach the last mile, the most vulnerable, etc., to be honest, this was not on the radar. People living with disabilities, assistive technologies and so forth, which is not spoken about in the fields that I was working with, which is global health, right? So, right, it's a problem. And I'm continually seeing it now as we engage with countries, and now I'm much more aware, of course, but the level of lack of awareness, right? It's not even about, we talked about this morning about people, in India, doctors, or not knowing that, it's not one size fits all. I think the lack of awareness is even at a more fundamental level where many people don't even know that there's such a thing as assistive technology, um, and what kind of products are out there, and how do you go about finding them, and so forth. And that's including, when you're talking to some organizations of people with disabilities, or caregivers, not to mention, of course, folks in the ministries and that have no clue, that have never heard about this. So it's really quite daunting, sort of the starting point as we begin to engage with countries. Um, there are ways around it, and I think together as a community, we are making progress, and will continue to do so. But I think that has to be recognized as a priority, and everything that we do is that very strong kind of awareness raising effort that is required. The second thing is, and that's a little bit more complicated perhaps to address, but really, really important, is the fact that this is really not a sector per se. There is no AT sector today, I would say, right? It's still completely fragmented. You've got vision, and you've got hearing, and you have mobility, and you have the different domains, and each have their set of actors, and they don't talk to each other necessarily. Ministries who touch upon AT are also fragmented, right? You've got the Ministry of Health that has a role to play. You've got Ministry of Social Welfare. You have Ministry of Education. You have Ministry of Labor, Ministry of Finance, of course, and none of them feel responsible for this, right? And they're not coordinating. They're not talking. They're each in some cases doing something related to AT, but not in any connected or systematic way. Fragmentation also with civil society. A lot of very small NGOs and local charities and church groups trying their best to do something, but it's not adding up to what it should. And then fragmentation also with private sector, which has a critical role to play here, and local innovators and startups that are, popping up everywhere. But there's no connection between that ecosystem and then the policy discussions that are happening at country level with governments and so on and so forth. So really, that fragmentation is one of the things that sort of scares me the most in terms of how do we build a sustainable system, given this where we're at, right? And so one of the things that we really encourage in our approach is building coordinating mechanisms that are multi-sectoral, finding champions in countries, not just at the national level, but also at the subnational level, where a lot of the decisions today are being, sort of devolved to, and all the budgets sit. But it's a long road ahead. And then the third key takeaway, and that is related to the fact that I think there isn't yet an AT sector per se, is that there is very little expertise on the ground to help figure things out. So we have a growing number now of tools, global guidance, and norms, and specifications and trainings that are available, but translating all of that into implementation is a real challenge, right? And countries, be it decision makers at policy level or practitioners and so forth, need to better understand this and need guidance. But today there isn't that expertise on the ground that's able to decipher it from an AT perspective. Yes, you've got specialists, of course. You've got physiotherapists and audiologists and ophthalmologists and so forth, even though often not enough either of those. But there's no AT expert that's able to look across all the domains and really be able to advise on, how do you strengthen systems to increase accessibility. So I think we need to focus a lot more on trying to think of ways to build that as a discipline at country level, which hopefully would also then help generate greater consensus, because that's also one of the things we're struggling with. There is no consensus about what works, what doesn't work, and hopefully GDI Hub are going to help us identify more of that, right? But today it's it's often an ideological fight between different people who just have very different ways of seeing things, and there's no real consensus, and you don't then have that expertise on the ground to really provide that guidance. So I just wanted to share some of these learnings, not to kind of, it may sound a bit depressing, but I think it's just that we need to realize that even as much as we need to figure out how to finance AT and how to have the right human resources and the infrastructure and the workshops and everything, you've got these fundamental basic systems issues that we need to address, and we can only address it if we collectively come together and do it. And the good news, though, is that I think there is a growing momentum around this. We are seeing more resources. Earlier this year, there was some great announcements from FCDO. We're hoping to be able to make some really good announcements in the near future about more resources coming to strengthen the assistive technology sector globally. And I really think that we may be at a turning point, hopefully. And then if we can address some of these things early on, we may have a shot at reaching our goal by 2030. Thank you.